800-597-9323. Call right now. 800-597-9323.
Fast Track Student Loans can get your student loans out of default, stop any wage garnishments, stop collection calls, and stop seizure of your tax refund. Give yourself a break. Stop the stress and get your student loan payments down to as little as $25 a month based on what you can afford to pay. 800-709-4395. 800-709-4395. 800-709-4395. 800-709-4395.
You're listening to JoCo Community Radio.
Well, good evening and welcome to the Reach Across Johnson County segment on JoCo Community Radio. You can join us live here on Facebook or download the TuneIn Radio app. It's free, where we are live 365 on JoCo Community Radio, the voice of Johnson County. Reach's mission is to support safe and healthy choices vital to the well-being of our youth, families, and community. The show will guide you, educate you, and inspire you to be a part of the solution and to reach out and help make a difference in our communities. What began as a local movement in the city of Midlothian grew to include programs throughout Ellis County with only a few short years and eventually expanded into neighboring Johnson County. And so here we are today. My name is Shari Phillips. I'm the community liaison at Reach Council, and I have my lovely co-host here with me today. I want to let everybody introduce themselves.
Hi, my name is Nikki Bowman, and I am the DFC coordinator in Johnson County.
Hi, everyone. My name is Ashley Petkin. I am the Johnson County Community Coalition Coordinator.
Hey, everyone. This is Emily Staffelbein. I am the COVID project coordinator for Reach Across Johnson County.
Awesome. Thank you, ladies. And so today we're going to kind of talk about public health, and we have a very special guest with us this evening, and I'm going to actually let Ashley introduce her because Ashley coordinated this for us, and I believe that she has a personal relationship with this person.
Yes, Dr. Ghandi was my college professor at Tarleton, and she was the public health director. Welcome, Dr. Ghandi. We're so happy to have you. Dr. Ghandi of public health for more than 15 years. She received her master's and PhD degrees in epidemiology from the UNT Health Science Center in Fort Worth, Texas. She has developed and taught 12 new courses for various colleges and universities in her academic career and helped establish the Bachelor of Science Public Health program at Tarleton State University in 2014. During her academic tenure, she has developed many leadership programs for her department and has been overseeing the Public Health Student Association activities as a faculty mentor since 2016. She is an avid researcher of adverse health outcomes and health disparities. She has a vast knowledge of infectious and chronic disease epidemiology and has been involved in many research studies involved in the two areas. Her current research areas include elderly health, student health, behavioral health, and disaster epidemiology. Her scholarly work has accumulated in numerous peer-reviewed publications. In her career, she has been able to secure small and large grants from foundations as well as state and federal organizations. Through grant-funded projects, she works in rural communities to facilitate healthcare access and promote education and vaccination efforts among marginalized communities. She engages her students in many research opportunities and grant and community health project planning, implementation, and evaluation phases. Recently, she was able to secure funding worth $425,000 from the Texas Department of State Health Services to address health disparities associated COVID-19 in Erath County as a principal investigator. She has secured other small and large grants to increase COVID-19 vaccination rates in 6 different counties of Texas: Cherokee, Shelby, Panola, Harrison, Anderson, and Henderson. Dr. Ghandi serves in many prestigious public health organizations such as the Texas Public Health Association, where she serves as a governing council member and executive board member. In addition, she serves as the assistant director at the Rural Communication Institute, RCI, at Tarleton State University. Through RCI, she is dedicated to improving the quality of lives of rural populations, especially underserved and underrepresented populations, through outreach workshops, community engagement and education, informational booths, podcasts, and social media campaigns. So, Dr. Ghandi, welcome. We are extremely happy to have you.
I'm honored to be here. Actually, I'm at a field site today promoting COVID-19 vaccination in rural East Texas. So I really thank this for this opportunity and to be able to, talk about my initiatives and my background and all the questions you have. I'm happy to answer for Johnson County today.
That's
Thank
awesome.
you.
Thank you so much for joining us. So, what made you decide to start a career in public health?
Yes, ma'am. So initially, my plan was to go to medical school and be a physician, but having an international background kind of, made me wonder if that one-on-one clinical approach would be sufficient to address the adverse health outcome needs out in different communities. So I started to explore my options in public health, and I do have a background in biomedical sciences. So I thought, I need to find a track in public health that would probably be good for switching over from biomedical sciences to public health side. So I found epidemiology as one of the tracks that was offered when I was exploring my options. So I started to look into that, and I found that it perfectly fit my needs at that time in terms of transforming from or transferring from biomedical sciences to public health. So because epidemiology has a lot of overlap with biomedical sciences in terms of pathophysiology, natural history of diseases. So I could use that background knowledge to look at disparity from public health side using epidemiology. So that's how my career started in public health, and I have not had any regrets for making that.
Hey, that's always nice when you can really, enjoy your job. And I know that we've been talking recently. We all feel so blessed, to work in the positions that we do. A lot of times it's a calling, and so we're truly blessed to be able to work in the field that we enjoy so much. I know we were talking recently about the epidemiology, and I can't believe I actually said it right this time. So, because I know a couple of our girls here, kind of like that area as well. So, y'all please jump in and help ask questions and stuff too. So, I know that we talked about, there are many tracks in the public health, and we were going to, you mentioned the epidemiology, so and you kind of touched on why it's the right field for you. Is there anything else that you would like to share on that?
So, if you look at public health as a discipline, it focuses on prevention.
Right.
And so we call prevention an upstream approach because, we are trying to, with upstream approach or upstreamist approach, what we are trying to do is, address the root causes of the issues. So, for example, if someone is going to develop cardiovascular outcomes down the road, we try to prevent the disease for that person by education and promotion, by telling that person, here are some lifestyle changes you can make. So that person never develops that disease down the road. Or if that person is at the beginning stages of developing the disease, we say, okay, here are the lifestyle choices. Here is probably one or two medication you can take to control your developing disease. So by doing that, we are, kind of stopping the disease from developing, or even if they are developing, we are trying to just nip it in the bud, if that makes sense, so that we have a healthy overall population goal with public health approaches.
That's awesome. I know when you mentioned the upstream deal with us working in prevention, also there's an analogy, and so a lot of times when we are talking about, why we want to check, affect the environment, and not maybe always individually. I think the analogy is, they talk about the stream, and you're the side of the bank and you notice these people, flailing in the water, that they're having difficulty, and you want to help that person. And the more you pull people out, more people have fallen in, and things like that. And so finally somebody, takes the initiative to go upstream and find out why all these people are falling in the water, and to make the change there.
Yes,
So,
ma'am.
so
Finding the
we
root
hear
cause
that.
of the problem is what we
Absolutely.
are addressing, and I think we are collectively doing the same thing from different angles in different communities.
That's awesome. Anything on the epidemiology that y'all want to touch on?
I know you love epidemiology.
I just think it's cool. So I was excited because I graduated with my bachelor's in public health. I didn't go into my master's because I wasn't sure which field to choose, and so I just didn't choose one, and I decided to go into work instead. So honestly, I just think it's cool, and I think it's funny that you said the biomedical sciences, because that's something I was also looking into. And it's like, oh, this makes so much sense.
Yes, yes.
Absolutely. So
With
how
that
is your
background,
go ahead.
epidemiology makes a lot more sense because, at the end of the day, we want to be successful with our interventions when we are launching them at the community level. So if you understand the natural history of diseases, we know exactly at what point we need to step in and, take care of the problem or address the problem. So having that, medical background kind of helps with intervention success down the road as a profession.
So do you typically recommend that? I mean, I know there's so many testing that people can do now to see if they're predisposed to certain things. Do you typically recommend that people look into that if they have a family history?
Yes, ma'am. So that's a great question. So if there is a treatment out there, if there is a solution for those genetic diseases, yes, certainly I will say go and, have that test done. But if there has been nothing developed for that specific genetic disorder, then, you might not want to do that just to reduce your anxiety.
Right.
Yes, if there is a solution and care treatment plans, yes, we should recommend that. But sometimes, knowing the genetic predisposition kind of makes people anxious if there is no treatment available out there. So sometimes you have to make that call for yourself.
Right. Yeah. Well, I look back, think, things have really come a long way. When I was 17, I'd lost my dad to cancer, and I know now, from the type of cancer he started out, he had a tumor on his kidney, and of course, he lived almost a year from the day that they actually removed his kidney, but it had moved into his liver. But he had been in well, we didn't have family history of cancer in the family, but he worked at a company that dealt in chemicals and things like that, and so he had kind of gotten exposed to some stuff, being in the plant. But it always made me wonder, is that something that I need to be watching for and things like that?
When did they start, like, I guess, noting cancer? Do we know whenever that started being a diagnosis? Because how far back does it go? Or did it come, I guess, from us?
Well, no, I think I think the generation before us had dealt with it because I'd heard of cancer when I was
But
little and things like that. So I'm thinking it's like my parents' generation. I don't
that's
know.
when they started getting diagnosed.
I
Do
think
you
more
know,
often.
Dr. Ghandi?
What specific cancer?
Any, like, just people getting diagnosed with cancer? Do you know when
So
that started?
a lot of awareness was around the industrial era. Up until then, people didn't know how cancer occurred. So a lot of awareness happened, especially after I would say 1940s.
Yeah.
Yes.
Yeah, and it's tough for a 17-year-old to lose her dad, and but I look at it now because when he was almost 42, he died just
Gosh,
before.
so young.
Yeah, and so of course when I got to where I was almost 42, I started having
Mhm.
horrible anxiety, worried about cancer and things like that. But I know that even now, I mean, things have come so much further in the things that they've you know in how they treat cancer and things like that, and the various preventatives. that people can take and stuff now. So I found it really interesting and everything. And it's, sometimes when you hear the C word, it's rather scary, but a lot of times now, especially if you catch things early, they can do a lot with that now. So I'm really prevention and preventative.
Mm-hmm.
That's kind of a big thing for me. I want to be proactive in my health as much as I possibly can. So.
Yeah, I really love the approach of prevention of diseases by our lifestyle changes, like getting regular physical activity and what kind of food you're eating, getting regular sleep, making sure you're getting the right kind of vitamins, proper relationships, like just the overall holistic well-being. And I learned a lot about that from Dr. Gandhi's class, your health education and promotion. And I know that's not on like our technical agenda today, but do you mind kind of sharing about that course, Dr. Gandhi?
Yes.
Sure. So, absolutely, I'll be happy to. So, health promotion is mostly about addressing social determinants of health. What's in your environment, what kind of food access you have. Do you have a grocery store that sells fresh produce? And then also transportation to healthcare, right? And healthcare access. Do you have insurance? So all these social and economic factors affect our health. It's not one thing; it's a holistic set of factors that affect health. We call them social determinants of health. So health promotion class is mostly about that. And then I will switch it to EPI because what you addressed is also partly EPI because we talk about primary, secondary, and tertiary prevention, right? So in public health, we focus more on primary and secondary interventions because that's when we can save a lot of lives if we adopt those approaches, primary and secondary. And the first one that I already addressed is stopping the initiation of the disease. The second one is someone has a risk factor, but we are going to give that person medication and have that person, adopt some lifestyle changes. So that's secondary. Tertiary is pretty much like you manage the disease. You already have the disease. Now you take medication and just manage your disease. So public health primary focus is primary and secondary prevention, and there is a lot of overlap of information between epidemiology and health promotion. I teach for that matter because I cover social determinants of health in both the courses as well as these three sets of preventive approaches.
That's really cool. Yeah, Ashley was very excited that you agreed to come on and talk with us today. Well, I know that, okay, there was something I was going to ask. Oh, the COVID situation, and do you talk about that very much in your classes and how that prevention and things like that are important?
Yes, so I'm teaching epidemiology this semester, so we have a talk about COVID in every single class of mine because we talk about data, we talk about mortality, morbidity, the rise and fall when different strains came, right? So we talk about that a lot. And my students love to look at interactive dashboards where we can look at the cases almost live. There's a little lag period for data reporting, but we talk about, what could have been working around, certain specific time in specific time period versus now. So we talk about strategies, vaccination in different parts of the United States and all over the world. So in the last class, now that we are getting deeper into this, I talked about, okay, how are we doing with vaccination, in the United States compared to the rest of the world. So I pulled up a map and showed, which countries are like doing a fantastic job, in vaccinating their population versus, United States. And of course, we have variation statewide also because we have, so many states here. So some states are doing really good, some states are a little bit behind. And within states, then you have county variation. So the reason why I'm in East Texas is because there are very low rates of vaccination. So I'm trying to push that in East Texas, especially in the counties that Ashley mentioned during my introduction.
Well, do you think that, well, I was trying to think which way to ask the question first. So how does the United States compare to others? What country is actually doing better on the vaccinations?
Great question. So China is doing really great. Taiwan is doing great. So there are specific countries like that. Canada is also doing good, I think, because there are so many countries on that day. So those are, well, China and Taiwan for sure, that I can be certain they are doing really good. But there are other countries that are doing much better than the United States.
So how would you say that the United States rates? I mean, do you think that we're getting better?
We are getting better by the day.
By the
Public health works on hope. So we are always hopeful. We always try to do our best in educating communities about the benefits of vaccination. And it has worked over the centuries. Actually, vaccination is one of the greatest public health accomplishments because we are, warding a lot of infections in the United States just because of the fact that we have vaccines for them. We don't see infections around, and people forget that they were here not too long ago. So we constantly bring that conversation back, and I pull up a chart where, how like the mortality rate pre-vaccination era and post-vaccination era, where we can see the differences in mortality. So those kind of visuals really help with education.
Absolutely. I know. So my mother-in-law, she contracted polio, and so she was pretty good about making sure that her kids, the vaccinations. And I remember my mother saying that she knew people. My mother's in her 70s now, but she knew people that had contracted polio, and so. But I know that even some of my nieces and nephews now, some believe in doing vaccinations and some don't. And I think that once you've seen something that's been eradicated and then all of a sudden it's starting to come back, it just, I don't know, it makes me rethink some things at times. I've always had that fear that, what if my child was in that percentage, that had some sort of reaction or something like that. But I think at the time, of course, my doctors were really good about encouraging me that, the consequences of not doing it versus doing it, it was so much more beneficial. But I do see a lot of that. And then, of course, uh, my kids have started having kids now. And one of the things that they recommended for us is to get the booster for whooping cough, because whooping cough was making a comeback again. So it's
Absolutely.
vaccinations can be important. I mean, I know that there's been some families that have had, kids have had a reaction to it, and so they're adamant about not doing it. So it's one of those things that, I guess, personal, you know, how it affects people personally and things like that. But it's scary to think that we might have, something that could come back that had been eradicated. And then, of course, talking about, COVID. One of the things we used to worry about, this time of the year had been flu in the past. And of course, I have not heard very many people even talk about the flu probably in the last 2 years, actually. And I don't know, do you think it's because we all got more conscientious about washing our hands and touching our face and things like that?
Well, it's interesting. That question is really interesting to me because we started wearing masks 2 years ago, right? So what
Right.
that means is that we are probably controlling flu that way as well, because we are wearing masks and it's a respiratory disease. So flu and COVID works the same way as far as the transmissibility and the mode of transmission. So with all those precautions we were taking, it definitely helped with the flu, outbreaks.
But they're not wearing the mask as much now, and I'm not hearing flu outbreaks.
I don't.
The flu kind of starts to wind down around this time. The peak is, it starts around
The fall.
October, and then the peaks around February, and then starts coming down. I'm talking about the incident cases. So, yeah, flu is about to go away, basically. So we are not worrying about that.
We're all getting to that. The allergy. I don't think the allergy season left me this year.
I feel like people have been complaining about allergies year round.
I know what
It's
Mount
torture
Cedar.
up
It
here.
is. It is.
I'm from Central Texas, and like cedars everywhere, and I
Yeah.
get that. You get used to it, and then I moved up here, and they said it's like an
a
allergy dust bowl is what they told me when
Yeah.
I moved here, and allergies have been year round.
It has been.
Yeah,
And
I
of
live
course-
on Zyrtec.
Yes. or Flonase. Or
Yeah.
That's why we have the preventative. I mean, if I don't, then I sound horrible or I feel horrible if I don't take my allergy medicine. Is anything else, girls, that you want to touch on that before we go to the next? Okay, so how has your journey been in academia teaching public health?
Oh, I absolutely enjoyed this career because I get to create agents of change for the communities, and Ashley is one of them sitting with you all today. So, I mean, I'm already reaping the benefits of what I have planted. So, they make me really proud, and I hear she's doing an amazing job,
She
in
is.
terms of substance abuse education and all of that, which is much, much needed, especially for the adolescent population. So, I want to create more of those and send them back to the communities so more public health work can be done. But I have truly, truly enjoyed this career. I do not regret for switching to epidemiology back in the day when I did. And, just being able to impart the knowledge of public health, which is really not considered as a mainstream profession, which should be considered as a mainstream profession in the United States, because we have people living with multiple comorbidities, and there is no other way to address that except to, create more public health professionals out there so we don't have this, sick population with lots of diseases. And also, talking about healthcare costs, I mean, we spend a lot of money on healthcare, and compared to that, the return is that our population is not healthy, so there is so much disparity in that regard. So if we create more public health professionals, if we create more health educators, if we create more community health workers, I think we can see the future of America better in that we can see our population more vibrant.
Hold on one second, Dr. Ghandi. It's actually going to that commercial. So y'all stay tuned.
Hey, Jill, congratulations on your son getting into the college of his dreams and with a full scholarship, too. Yes, we are so proud of him. I have to be honest. I'm a bit worried about our daughter getting into college. It's so competitive out there, and I feel overwhelmed with where to start. I completely understand. Listen, I felt the same way, and then I met Dr. Gina of Education Prep Centers. She put a plan in place that helped our son stand out in the admissions process, and that gave us a peace of mind for how to create a financial roadmap for his future. Wow, that's great. Sounds like I need to give her a call. Yes, she definitely helped our son find the perfect college, meet all his deadlines, and help us feel less anxious about the whole process. You need to reach out to her. Just check out educationprepcenters.com and set up a complimentary assessment with Dr. Gina. You'll be so glad you did. Education Prep Centers, college admissions made easy.
Out-of-date carpet giving you the blues? Tired of your old dingy and broken tile? Let my friends at the Floor Store in Cleburne, Texas give your home the makeover it deserves. This is Old Taco Joe coming to you for the Floor Store. Whether it's carpet, tile, wood flooring, or real wood laminate, the Floor Store can cover all of your flooring needs. Located at 405 West Henderson Street in Cleburne, Texas, owner Brent Harris can help. Shower tile, tub surrounds, even backsplashes. Give them a call today at 817-641-9444. The Floor Store, they got you covered.
When you're hungry for tender brisket or some delicious homemade cobbler, then look no further than Leech Brothers Barbecue, located at 1106 East Henderson, Cleburne, Texas. Leech Brothers has been family-owned and operated since 1950. Take it from me, Taco Joe Orwinski. Todd and his family have been filling my belly breakfast, lunch, and dinner for a long time. Heck, I even have my own booth, open Monday through Saturday, 6 a.m. to 7 p.m. Come see them for dine-in, carry-out, and all your catering needs.
You're listening to JoCo Community Radio.
Welcome back to the second half of Reach Across Johnson County. Joco Community Radio is proud to be the voice of Johnson County, Texas, and is live 365 on TuneIn Radio Network. To listen, go to tuneinjoco.com and download the free app. All of our shows can also be found on any one of your favorite podcast platforms, such as Spotify, iTunes, Amazon, and Spreaker. Check out the lineup and more on jococommunityradio.com. Thanks for tuning in. And this episode and more are brought to you by Patriot Claims, making your insurance work for you. Reach out to your Texas sales rep, Nona Reed, at 844.tex.hail, which is 844-839-4245. And thanks, Patriot Claims, for sponsoring our show for us. And I apologize, Dr. Ghandi, that we had to cutting you off short kind of mid sentence. So we do want to pick up where you'd left off.
Okay. Well, I can't recall what I was saying though.
That's okay.
Dr. Ghandi, I wanted to kind of ask about your opinion regarding public health. I think a lot of our listeners may not even know exactly what public health is. And so I know we've kind of talked about it in a preventative state, but if you wouldn't mind just kind of giving like a basic definition, and then I have a follow-up question after you answer that.
Sure. So I might repeat myself, but it is purely about disease prevention and prolonging life, giving tools to the community members to, have access to food, healthy food, access to healthcare, access to information so that they can make that informed choices about their lives and, live a healthy and productive life. That is the basic definition of public health.
I feel like most people haven't heard about public health. Really, a lot of people haven't heard about it until the pandemic. So I'm kind of curious about your perspective on the field before and since COVID became an epidemic.
That's an interesting question, Ashley. I mean, we are pretty much behind the scene people. We are doing our work quietly in the background. We are making sure the food that our people are eating are safe and healthy. The water they are drinking is safe. It's fluoridated, and when you go out in your vehicle, we're making sure you have your seatbelt on because that is because of public health policy that you have to wear a seatbelt on, right? Or you have to put your seatbelt on. So these are behind the scenes work that public health does. And every time there is an outbreak, we are brought back in the scene, but we are always working behind the scenes. It's just that during bad times and outbreaks, we are given the spotlight, but in reality, we are always working behind the scenes. We're always trying to help people live a good quality life, wherever they are, whether they are living in rural community or in urban community. That's our, effort is to give you a good health and good quality of life.
That's so true. So that made me think of a question. So we're actually advocating for like a smoke-free air ordinance in and around Johnson County, specifically Burleson first. Thank you. And so
that's my baby too.
So I've actually worked on in several communities to help pass smoke-free air ordinances. And part of that came from again, a personal story for me is I had a grandfather that died from emphysema, and he was a pipe smoker. And seeing him in the last days of his life, he had to be in a tent and he couldn't breathe. And when, it was grasping for air, that as a kid, that made a big impression on me.
Traumatizing.
Yeah. And of course, and then I have family members that smoked, and, my deal is always complain because, if I'm eating or something, I cannot handle, having smoke around when I'm eating. And for some reason, it was a big turnoff for me. And then when I got older to where I was working, I worked in an office where there was a lot of smokers and, high stress, CPA firm. And so they smoked like chimneys in there. And I'd go home reeking of smoke every day. And then I had gotten to where, I developed a cough, and it's like, it was a nagging deal that I could never get rid of. And it wasn't until after I, quit working in the office where smoking was allowed, it cleared up. And so it made me more aware of,
What years was that?
That was in the late 80s. And
Isn't
so
it crazy how much
I
things have
know.
changed just
Yes.
since? I mean, even probably a CPA office now you couldn't smoke in, and
Probably,
not even if
probably not. Well, not in some. But I wanted to ask you, Dr. Ghandi, specifically. Do you, when we hear a lot of times that we're not telling people that they can't smoke. It's just being more conscious about where they are smoking. But we always hear that we're taking their rights away, and it's like, my thought is, well, we have the right to breathe fresh air and work in an environment that has clean air. Do you have any particular thoughts or anything from a public health aspect that you can enlighten us on how to address those type of questions?
Yes, ma'am. So that's interesting. It's interesting that you brought smoking, because smoking and lung cancer is one of my prime examples that I bring in most of my classes.
Yes.
We have studied so much about the adverse outcomes of smoking, and people are still not understanding that not only they are, being impacted by firsthand smoking, but they're also affecting others around them who smoke. Just like you said, you were, affected by secondhand smoke. So it's one of those things that about chronic diseases, is that you don't see what's happening inside your body, right? When you smoke, it's like, okay, maybe I'll get cancer 50 years down the road. So, but internally, your system is getting affected, and smoking is one of those risk factors that affects every single organ in your body, right? And every single organ, and it puts you at risk for so many different cancers and other chronic conditions. So that's the truth about, or the fact about chronic conditions, is that you don't get to see it develop as it happens.
Right.
And then now smoking is still prevalent in the adult population, but there is another layer of complexity when the youth started vaping, right? So now not only do we have this smoking issue that we need to address, compounded by that is the adolescent health due to vaping. And vaping was actually advertised to people that wanted to quit smoking. But so the data is not really supporting that. So we really have gotten into this complex situation with electronic cigarettes and smoking, and people are not realizing the adverse outcomes that could happen, that could affect them down the road. And it's still prevalent that that mindset that, oh, I'm not seeing anything right now. If I smoke today, I may or may not get the disease down the road. So that mindset is still pervasive, and we're still struggling to get over that battle.
Right. We were making such headway there for a while, seeing the reduction in our youth using, and we were thrilled when they did the tobacco 21 and raised the age limit, because that took the likelihood of someone that was 18, that was still in high school, being able to provide things to their peers that were younger than them. And so we were really excited about that. And then, of course, then the vaping hit, and it's like, man, it took off like gangbusters. And we were seeing so much stuff, with the EVALI, the kids that were having damage done to their lungs, and it was really scary. So I mean, we do a lot of presentations regarding vaping, but the thing about the vaping too is, we're still within the first 10 years since the vapes probably came out. And so we don't even know what the long-term effects of vaping is going to be like. I mean, look how long it took for us to find out how bad tobacco smoke and things were for us. And, that it's a big cancer causing agent, and, that it does so much damage to your body. And, I have concerns about, the vaping, because I have a son, he quit smoking cigarettes, but he vapes. And, my concern is, that nicotine addiction is so difficult for people to sometimes overcome. But with vapes, there's no end. I mean, it's one of those devices that you can pick up, put down, pick up, put down, that there's no end to it, like there was with a cigarette. And so it's really scary to think what the outcomes are going to be for those that actually,
So I'm not lying to them just to get them to understand how long it took us to find out what, tobacco did to our grandparents or our parents, and
absolutely.
their eyes get really big. And I really do think that that's, if they're not listening to the rest of the presentation, they listen to that.
They do, and one of the things I also do, in addition to what you said, is finding really not gruesome but graphics that really shows
Yeah.
like let's say a lung of a little tissue of someone that has smoked for 20 years versus someone who has not. So that
We have
is kind
pig
of
lugs that they like.
even though we are educating, but they are really seeing like what's happening inside their body or the likelihood of their lung turning that way. So it kind of scares them when you present those visuals.
I think that's one of my biggest fears is not being able to breathe. Drowning scares me, but the thought of having problems, whether, somebody that has COPD, people that struggle to catch breath. I mean, if I hyperventilate, of course, it makes it worse because I panic, and it's like I'm not getting enough.
It's so funny that you said that because we just moved to a new house, and we bought my parents' old home, and they didn't have any smoke detectors, or when they did, they took them down. So now we have some of our dogs that stay in the garage at night when it's cold, and we have a heat lamp out there. And I ordered 2 cameras last night on Amazon because I got up at 2 a.m. I was so petrified that the garage is going to catch on fire. They're going to then catch on fire. And then it's going to go up to my son's room that has, the lung issues anyways. And then you just start getting all of that in your head. So I ordered some cameras on Amazon so I can look that up. But yes, smoke is scary.
A friend of mine, they lost their house due to heat lamps for their animals. And
yes.
So it's scary.
It's so, I mean, that's just like, I don't know, a nightmare to even think about. And to think about your animals would be the first ones to go. And I know.
Think about my baby Ellie.
It's so sad. And to think that they're can't even get out because we have them locked up in their crate, that's so.
Well, we drag us a little bit. So, but public policy, that's a huge thing when it comes to public health is, to affect, not just one person, but everybody. I mean, we have to do that through, public policy, sometimes our environmental strategies that we work on. One of the other things that we talk about when we're talking about change and environmental strategies, it's like, if you're in a room and it's you're cold, you can go and put a sweater on and things like that. But to be able to affect, the whole room, you have to go over and adjust the thermostat a little bit to make that change. So there's so many different little. We learned this through our CAD. Like that. Yeah, we learned things like that through our CADCA trainings and stuff like that. Really, but that's the kind of things that we have to share to make the impression on somebody else. I know that one of the city councilmen in one of the other communities I worked in, he was totally against the smoke-free air ordinances, and he said that he just didn't like government, even though he's city councilman. He said he didn't like government telling people what they could or they could not do, and so he said that he didn't think that it affected other people's. And his mother actually was another person. She had emphysema, but I told him, I said, when in talking to him, I said, well, he said, the next thing you're going to do is you're going to tell me I can't have my big gulp drink and everything. And I said, well, look at it this way. I said, when you're smoking somewhere, it affects me and the people that are around you. But if you're drinking that big gulp, that's only going to affect you. So I said, you have to kind of think about what's going to affect the whole. We're not telling people they can't smoke. We just need them to be more mindful about where they are. Mm-hmm. And, I feel for these kids that get in the car with people that,
I know
that smoke.
Is that not illegal?
Not in the United States, unfortunately. I've heard of other countries that can bring charges up against. But sometimes, and especially I think in Texas, we're a little bit behind. I can't believe that the state hasn't stepped up and made a policy regarding, smoking or things like this. But, Dr. Ghandi, when we go out and do presentations at our schools and our kids, they tell us, my mom smokes or my dad vapes or something like that. And, we tell them, if they do this around you, then maybe just go to another room or something until they're finished. But it breaks my heart when they're in a vehicle with somebody and the windows are up and they can't do anything. It's like they're scared, which they have every right to be scared. And it's like, well, you know what? You need to have a talk with your mom and dad and tell them that you're scared about this and that you worry about their health, but you also worry about your own health. And sometimes it's hard to educate these kids. They're very astute, but it is a little scary at times.
Yeah, and that's great. Yeah, I mean, kids are fearful of their parents and what they're going to say. I have also run into kids, recently that have actually advocated their parents to go and get vaccinated. They think that vaccines save our lives and saves our lives, and they educate their parents and take them to clinics to get vaccinated. So, one of those things that we need to start teaching kids early on, that advocate for yourself, advocate for your health. That's really important through a K through 12 system.
There's a commercial that I've seen that I thought was done very well. And I think it had to do with, it's one of the yes, yes. And I
Yes.
thought that was done really good. It's like,
Powerful.
yeah, where the kid, where it took them. Have y'all seen the commercial that I'm talking about? It talks
think
about,
so.
why didn't you get me this vaccination? They had problems, and it was like it cycles back where the kid gets the vaccination and everything, and then doesn't have the problems, later on. But anyhow, I thought it was really well done because I remember that was a controversial thing for us, is whether or not to get our kids done, and so my kids had a big voice in that, and they were thinking, well, I'd rather get it done and not have problems later on. So I don't know. It's another one of those deals. Yes, ma'am. Oh, yeah, we're already okay. So let's go to another question. So, what are some of the courses that you teach at Tarleton, and which one is your favorite? Which I think we might have touched on it a little bit.
Yes. So before I started the teaching career, I used to wear epidemiology hat a lot. This is my career. This is how I'm going to look at things. But after I started teaching and after I started to see the overlap, and I feel like all the courses in public health are equally important because we talked about policy. Even though I don't teach health management and policy, I do that bridging when I'm talking about, interventions, like, because policies or are when rubber meets the road, like we said,
Right.
during the discussion earlier, because we can have these great inventions and recommendations, but if it doesn't turn into policy, it just sits at the desk. So, so health management and policy is equally important. Health promotion is equally important. I also teach biostatistics because, our kids need to have a good understanding of data in this day and age because we are dealing with big data now. And so they need to be able to use the data and relate it to kids.
Yeah.
And your healthcare for statistics. Don't forget about that class.
Was it hard?
Yes.
It sounds hard.
I didn't take
Like me very much during
No,
that
I
semester.
graduated from Schreiner in public health.
Oh.
And statistics, I had to take it twice.
Yeah.
Sadly, it was such a hard class.
What are some of the student engagement activities that you do through your programs?
So I don't only teach in a traditional didactic way. I try to embed experiential learning activities and even research sometimes. So I'll give you an example of a program that I implemented in my health promotion class. It was called A Matter of Balance. And I worked with Area Agency on Aging and Texas Health staff to, embed that into the curriculum. So what I did in my health promotion class is during the first half of the semester, our students or my students were trained by the trainers to be educators on the Matter of Balance class. And then after the first half of the semester was over, after the midterm exam, the students went out into the communities and trained, other community members on fall prevention because they had earned the certificate by that time. So, and then I also embedded a research component to see whether or not these kind of, interventions of, bringing an external program into the curriculum works for student learning, for community engagement and learning, as well as, overall in the teaching or pedagogy aspect of the class. So I integrated all that component, and it was very successful. The students had, great experiences interacting with the communities, learning from the trainers, and also getting that tool of, or badge of certification saying that we did it and we can use this for future employability and so forth. So it was
I
a
think
win-win
that's great.
situation.
Absolutely. So that that touched on, you had mentioned that you do involve your students in the community activities. Do you also involve them in your research?
Yes, ma'am. So I am very, very intentional about exposing students to research work and understand research methodology because, come tomorrow, they might be working for NIH or any health organization that requires them to do data analysis. So, um, I don't force my students. I say, well, here are some research, projects that you could potentially engage in, and students who show interest, I offer them that opportunity. And so, yes, and, my previous students have gone on to present their research at national level conferences such as
Oh, wow.
American Public Health Association. They have gone to present at the Texas Public Health Association conferences, and even we have so many symposiums at Tarleton that they could present their research work at. So I engage my students in that way, with data collection, analysis, and also presentation of their research at all these different places and educational conferences.
That's awesome. That's awesome.
Dr. Ghandi, we heard about your projects in Northeast Texas, Counts and ERATH Engaged. What are the objectives of these projects, and could you give us details of the initiatives you have launched through these projects?
And let me just mention, we've got about 3.5 minutes left on the episode.
All right, so I'm going to make this really fast. Northeast Texas Counts primarily, we launch many programs through that, title. So our recent initiative is to boost vaccination rates in 6 different counties in East Texas. And I think you mentioned the different counties at the beginning of the show. So basically, going into these communities, creating these relationships with community-based organizations, hospitals, providers, whatever it takes to get people vaccinated. So we've had great successes before we applied for the grant. The vaccination rates were around 30%. Those who were fully vaccinated, now it has gone up to 40, 45 in some of those counties that we are targeting. So we are seeing the effects of our efforts. And it's not only us, there are many other organizations that are working together to make this happen. So that's our Northeast Texas Counts project. And on the ERATH Engaged side, we are trying to do the same or similar initiative, but it's to address the disparities associated with COVID-19. So we are actually looking into Tarleton students to, address their basic needs, because a lot of our students were impacted during the pandemic. They had issues with basic needs, they had mental health issues, they had other issues that they were dealing with. So we are trying to address their disparities through ERATH Engaged, and we are also targeting another community in Dublin, Texas, which is also in ERATH County, with similar initiatives, to promote health and to promote overall wellness on both the sides, for Dublin as well as for Tarleton students.
Oh, wow. That's awesome.
We have started working more in mental health, especially since the COVID epidemic. And you kind of just briefly mentioned that you have been working towards that with the college students in regarding COVID-19. Can you elaborate on that a little bit and just kind of what you're seeing?
Sure. So mental health is prevalent among college students all over the United States. It's not only at Charlton or certain colleges. So with COVID-19, a lot of students that are especially attending public universities have to deal with a lot of stresses. Some of them lost their jobs, some of them lost their housing. So they were under tremendous pressure, with living situations and other things. And some of them even had to drop out of school because they couldn't sustain themselves any longer. So all these stressors, affected their mental health. So we are trying to address that through Iraq Engaged.
That's awesome. Dr. Ghandi, thank you so very much for joining us this evening. It was a pleasure visiting with you about public health. I learned some things.
Thank you for having me on the show.
Absolutely. Is there any contact information you want to share?
Sure. I work for Charlton State University. You can, look up my information on Charlton's website, and it's pretty accessible to anybody. Just feel free to reach out.
Okay, awesome. And we'll post it in the comments as well. Thank you again.
Thank you, Dr.
Ghandi.
Bye-bye.
Bye.
Have a good evening. Bye-bye.
From Burleson to Venus and Grandview to Godley, this is the voice of Johnson County, JOCO Community Radio.
Let's be honest. Wheelchairs are heavy, bulky, and ugly. If you carry a wheelchair in your car to take care of a loved one, you know how hard it is getting that clunky, old-style wheelchair in and out of your car. Introducing the Feathershare Wheelchair. At 13 pounds, it's the world's lightest wheelchair. It folds in seconds and fits neatly in your trunk, backseat, or closet, so you can take it everywhere. And it's only available right here. Order yours today and get a free wheelchair case, a $50 value, yours free. The Featherchair, the world's lightest wheelchair, is just